Confirmed COVID-19 cases in the Philippines doubled over the weekend. The country now has 10 confirmed cases of the SARS-like disease.
President Rodrigo Duterte is expected to formally declare a public health emergency to curb the spread of SARS-CoV-2. JC Cosico tells us more.
The Health Department has raised Code Red Sub-Level 1 alert over the coronavirus disease or COVID-19. This means concerned government agencies must expand their response to curb the spread of the infection.
This is a preemptive call to ensure that national and local governments and public and private healthcare providers can prepare for possible increase in suspected and confirmed cases.
The DOH has also asked Malacanang to declare a state of public health emergency.
The DOH has recommended to the Office of the President for the declaration of a state of public health emergency, which will facilitate mobilization of resources, ease processes, including procurement of critical logistics and supplies, and intensifying reporting.
The move came after the country's first local transmission of the SARS-like virus was confirmed on Saturday. A day later, the DOH reported 4 more cases, bringing the total number of confirmed infections to 10. One of them is a 38-year-old Taiwanese male who has no history of travel outside the country, but came in contact with an infected Taiwanese foreign national who visited the Philippines. The 8th case is a 32-year-old Filipino male who reportedly traveled to Japan within the past 14 days. An 86-year-old American male is also among the new cases. He has pre-existing hypertension and history of travel to the U.S. and South Korea. The 10th case, meanwhile, is a 57-year-old Filipino male with no history of travel outside of the country. Public establishments such as malls are now ramping up efforts to mitigate the outbreak. Temperature checks are now becoming a norm.
Para ma-rule out din kung may fever nga yung papasok doon. At least somehow matatanggal yung mga may fever, hindi makakahawa.
Some bus terminals are also providing alcohol and hand sanitizers to passengers.
Para protection na rin, kailangan mag-ingat na lang tayo. Lahat maging malinis sa katawan.
Malacanang has now declared a public health emergency to help curb the outbreak. For News 5, JC Cosico, we are One News.
The Quezon City local government confirmed that 1 resident tested positive for the coronavirus. Let's get more on this from Quezon City Mayor Joy Belmonte, who joins us now over the phone. Good afternoon, Mayor. So reports are confirming that there is 1 case of COVID-19 in Quezon City. Can you tell us more about that? Is this person one of the positive cases that had already been reported by the Department of Health along with that 1 case from Marikina?
No, actually, well, I don't know about the case in Marikina, but this case was reported to me just this morning at 6:30 in the morning. So I only got confirmation about it today. But apparently, they got confirmation last night, the DOH. So, yes, this person is from Quezon City. He is 57 years old and does not have a history of travel, which is very interesting, although he has had contact with persons who have had a history of travel. So, at the moment, I really can't give you that much information yet because I just sent my team to
All right.
His family and other household members to try to do contact tracing, find out who he's been in contact with in the last few or 14 days. And in the interim, we are also going to be meeting with various national government agencies today. So I can probably give you more concrete information pertaining to steps to be taken and strategic action on the part of the city later in the afternoon or in the early evening.
All right, you did answer my question. So just to clarify, Mayor, is there no current SOP with the LGUs and the NG or the national government when it comes to, a positive? As we know, it exploded over the weekend from the couple of cases on Friday. Now we have 4 additional cases. But prior to all of this, was there already a plan on how to coordinate? What do hospitals do? What do the local barangay health workers or city health workers do once they find a case? Is there a protocol that's already in play?
Yes, actually, there are protocols in place. The DOH has given us protocols, and we have been following these protocols very religiously. And I believe that we are being called to meetings today just so we can be on the same page with regards to how to handle these cases, given that the protocols given to us in the past had to do more with those that had come from countries that were infected. But now we are seeing cases wherein there is internal transmission. Persons not without a history of travel are being infected, and that probably calls for some amendments to the protocols. But with regards to what to do when there is a positive case, how to handle a positive case, how to handle how to do contact tracing, etc. All of these are the same, and we have been trained on this. So the local government has been prepared with all the necessary equipment, like PPEs, like thermoscanners and masks, etc. We have been ready with these since before.
Right, Mayor, talking about the measures to be undertaken by the local city government, are you considering a citywide class suspension at this point?
At this point, it is too premature for me to make even to speculate on calling off classes. I do not like to make decisions without seeing the big picture and having been informed of all the necessary information that I need to make a sound decision. So when it's on the table, probably I cannot say that I will do it this early on.
All right, thanks, Mayor. One last question before we let you go. In case any QC resident suspects that maybe a family member, a friend, or a colleague, whatever, might be down with the COVID-19, where do you suggest they go if ever they're listening right now? Because it can be a little confusing. You don't know where to take yourself, even though you are willing or wanting to get checked. So just to clarify, where would QC residents go?
Well, our three locally run hospitals are equipped to handle cases of persons who feel they might want to get tested or they might have symptoms. And these are the Quezon City General Hospital in Project 8, the Novaliches District Hospital in San Bartolome in Novaliches, and the Rosario Maclang Bautista Hospital in Barangay Batasan Hill. So our local hospitals are ready to take in persons who feel they might want to be tested or at least to get proper advice. No? And in addition to that, they can call our hotline 122, and that is a 24/7 call center, and they can report that they would like to be, tested, etc. And we can send an ambulance to them, actually, and bring them to our hospitals for further validation.
All right, hotline 122 for any QC resident who are suspecting that they could harbor this disease. Thank you for your time, QC Mayor Joy Belmonte, joining us over the phone.
Thank you very much, and thank you for the opportunity to air our concerns here. Thank you.